My objective today is to share with you the message of the ManVsProstate Crusade. The time is now for BPH BPO care to prioritize the preservation of bladder health. Drugs temporize symptoms so we can triage and obtain bladder health baselines to deobstruct at the right time to prevent late-stage disease. My promise is that together we can affect positive change away from a drug-first approach to a data-first, bladder-centric, pro-diagnostic paradigm, where all of our patients can live their best lives chemical-free and catheter-free. With saving bladders, we are defenders of the Detrusor. We swear an oath to preserve bladder health, to prevent late-stage BPH BPO, and to end the polypharmacy epidemic. And we fight on the landscape of LUTs. Our queen is the bladder, right in the middle. We defend her against damage and dysfunction, where BPH BPO is our mortal enemy. We support the evidence-based guidelines with our community-based manifesto titled The Preservation of Bladder Health for BPH BPO, which reminds us that we fix problems. UPJ obstruction surgery preserves kidney function. For BPO, deobstruction preserves bladder function. And we cherish this organ that is so amazingly unique that it cannot be transplanted. And we fight against the ever-tightening prostate that causes these cyclical increases in pressure with increasing tissue hypoxia, leading to the 3 stages of hypertrophy, compensation, and decompensation. And we trust the truth of trabeculations and detrusor damage as this disease progresses. We intervene before it is too late. As this study shows, as the prostate grows tighter, flow decreases, the bladder compensates with rising pressures until about the age of 62, after which it fails and decompensates. We embrace the window of curability. Yes, can we intervene before the onset of damage or before the damage is irreversible? We understand the 5 stages of bladder health. Yes, BPH is about bladder health. It is not transplantable, so let's take care of it. The heart is a muscle that pumps blood. The bladder is a muscle that pumps urine through that prostate that starts out about the size of a golf ball in the shape of a mini donut. As the prostate grows bigger, the donut hole grows tighter, and things slow down, stage 1. The bladder muscle now has to work harder. It struggles and becomes overactive, causing urgency, frequency, nocturia, stage 2. If you don't take care of it, the bladder muscle acts out like a rebellious child, contracts without permission, causing urge incontinence, stage 3. If you really don't take care of it, just like the heart can have a heart attack, the bladder can suddenly stop working, causing the emergency of retention, stage 4. And just like the heart can go into heart failure, the bladder can go into bladder failure, causing a lifetime of catheters. Worst case scenario, the heart can still be transplanted. The bladder has no such option. Yes, this is an oversimplification. The transitions are not distinct. The stages can be skipped and stages can coexist. Yet, it highlights how this BPH BPO can steadily progress to more serious stages. It highlights the possible consequences of choosing not to take action. It highlights our goal to prevent late-stage disease and the hope of reversibility if we can make the right surgical choice at the table of shared decision-making with the bladder at the table as an equal partner. And if we all agree that drugs are temporizing measures that buy us time to identify a treating mechanical solution to resolve this problem. We are not anti-drug. In sepsis, antibiotics are a solution. For BPO, deobstruction is our solution. Catheters are temporizing. Similarly, drugs buy us time to gather data, to triage, to trigger a bladder health baseline with a minimum of a cystoscopy. These bladder health baselines is our stethoscope to listen for struggling bladders. The criteria for triggering a baseline: urge incontinence, retention, IPSS 8 and above alone or in combination with decreased flow, elevated residual, thickened detrusor, or unacceptable risk. These data help us with surgical choice. What is the maximum you can do? That is your maximal approach. Or is it some fraction thereof? Remember, the bladders will always vote for a maximal deobstruction, but they're willing to compromise. One size doesn't fit all. It wants us to all have at least one option for each approach and factor in size, shape, and detrusor function. We choose data over drugs, not just for us, but for our patients. They want it. In this study of 170 Rezūm patients, 80% are saying no to drugs. Yes, COMBAT trials showed a reduction in risk with combination drugs up to 4 years, but with speculative reasoning, we can see that out to 10 years, the risk is never eliminated for stage 4 retention or surgery. 1 in 10 men on combination, 1 in 3 on tamsulosin. Drugs just sweep the problem under the rug. Drugs have a negative impact on bladder health for TERT patients and push them over 2 decades into the later stages of BPH-BPO. And we can see here from 1990 to 2010, as medication use went up to 43%, surgeries went down by 65%. And as a result, in 1990, 2/3 of men were having surgery for early stage LUTs. And then they were being pushed over 2 decades to later stages, with 2/3 of men now having surgery for the indication of late stage 4. Of more concern is that there's a 6-fold increase in failure to void late stage 5. But there's hope. With these 17 Rezūm patients, for example, with the right surgical choice, with shared decision-making and the trifecta, we can improve lives and we can defend the detrusor. So choose data over drugs. If you prescribe drugs, then triage your patients to obtain a bladder health baseline to deobstruct at the right time to preserve bladder health. Make our vision a reality of all of our patients living their best lives chemical-free and catheter-free as we prevent late-stage disease for an organ that cannot be transplanted. So please lean into your responsibility to defend and protect bladders, because we are defenders of the detrusor. So join the dialogue on LinkedIn, sign up at ManVsProstate.com, and let's go save more bladders.